Let us give publicity to HIV/AIDS and not hide it. Because the only way to make it appear as a normal illness like TB or cancer, which it anyway is to say it freely. And then people will stop regarding it as something extraordinary and the stigma will definitely be reduced. We saw in COVID so many VVIPs, so many actors, Bollywood's ministers, everybody got COVID. It was not a shameful thing. So we should make it more public. What is HIV? It's human, found only in humans, transmitted among humans, and preventable by humans. It's immunodeficiency where body lacks the ability to fight off these infections. And it's a virus, which is a type of germ, and it lives and reproduces only in human body cells. What is AIDS? Acquired, it's not received or inherited or gifted or genetic. It's protected. In this case, the system protects the body from disease. And deficiency is a lack of the immunity which we have, and it's a group of symptoms or disease. HIV is found in most of the body fluids like semen, breast milk, blood, and vaginal fluid. One cannot get HIV from tears, saliva, sweat, or urine of an HIV infected man. During unprotected skin to skin sex, anal, vaginal, oral, HIV can be passed on to the other partner. Contact with HIV infected blood or blood products. Sharing intravenous drug needles of HIV positive people from HIV positive mother to child is a vertical spread, and during breastfeeding. If you look at the timeline, it's just 3 decades old. And Francois Barré-Sino's got a Nobel Prize. He discovered it in 1984. And over a period of time, when we found antiretrovirals working, the incidences of HIV have been reduced. But still, there are about 20 million new sexually transmitted diseases seen each year, 20 million. And half of them are youth. And 1 in 5 new HIV infections occur in the youth at this age. More than 50% of women, half of all, are living with HIV/AIDS worldwide. It's the number one cause of death in women of reproductive age, and it's responsible for 60,000 maternal deaths across. 1 in 8 people live with HIV, still do not know they have it. See the menace they would be creating by having sex with somebody or exchanging blood or whatever it is. The prevalence is very high across the globe. Let me give you an Indian data. 2.1 million people are living with HIV. 0.2% HIV prevalence is between 15 and 50 years. 88,000 new HIV infections are seen every year. AIDS-related deaths are 69,000. 56% adults still are on antiretroviral treatment, and about children, there is no data. India has the third highest HIV epidemic in the world, and tuberculosis remains the leading cause of death among people living with HIV/AIDS. During this COVID, there has been a problem. There has been less detection, and this is today's Times of India. 7,000 HIV infections may have gone undetected. That is what they study. At 23% case fatality rate of HIV, the patients who have HIV and get COVID, the risk of death is much, much higher. 79% of the population in India is aware of having HIV status. Of this, only 70% are taking treatment, and the suppression we do not know. Which are the key populations who are getting HIV? These are the sex workers, men who have sex with men, we call them MSM, people who inject drugs, PWID, hijras, transgenders, migrant workers, prisoners, and truck drivers. 2017, there was an estimated 1.6% of female sex workers in India were living with HIV. Though Supreme Court decriminalized homosexuality by abolishing Section 377, still, despite the changes of legal environment, men who have sex with men in India remain extremely marginalized and face widespread stigma, homophobia, and discrimination. People who take drugs, 14,300 people who injected drugs were younger people, less than 30 years. See the menace they are creating. Being transgender is strongly associated with stigma and discrimination. These people lack the access of tailored HIV treatment and services. Migrant workers, truck drivers, prisoners, incarceration increases HIV vulnerability in all these patients. What are the sexual problems which occur in patients who have HIV? Men. Erectile dysfunction is a frequent problem for men with HIV, and the prevalence rate is 50% estimated. Low sexual desire, early or delayed ejaculations. What are the factors responsible for sexual dysfunctions in these patients? There are four important factors which are associated with sexual dysfunctions in patients who are having HIV/AIDS. The first is mental, second is hormonal, third is pharmacological, and fourth is associated comorbid conditions. The mental factors are there's a feeling of guilt from having acquired HIV via sexual transmission. And this may be a mental factor that negatively influences the sexual response, and he develops erectile dysfunction. Depression is known to cause erectile dysfunctions. In HIV positive men, sexual dysfunction was associated with avoiding strategies. They don't want to have sex because they fear that they may give it to somebody. There is stress. They don't want to take risk of casual encounters. They are on antidepressants. These patients develop erectile dysfunctions. In patients with HIV, we see hypogonadism. The reduction in the serum testosterone was one of the most frequent causes. Estradiol was often higher in men. 50% of them patients who were on HA, highly active antiretroviral therapy, due to augmented peripheral conversions of androgens to estrogens in the lipid tissues. Low sexual desire was associated with protease inhibitors, one of the type of drugs which we give for HIV treatment in the past and all. ED was associated with protease inhibitors, symptomatic HIV, AIDS, and tranquilizers. And retarded ejaculation was seen in patients with peripheral neuropathy. Comorbidities with sexual dysfunction also causes this thing like hepatopathy, liver disease, tuberculosis, diabetes, dyslipidemia, hypertension, vascular disease, and alcohol dependence. Not only alcohol, but many other substance abuse dependence. Peripheral neuropathy was very well known as one of the complications directly of HIV via the direct viral toxicity and also of the treatment with the drugs for HIV. So, how do we clinically assess? We need to have an open minded attitude when we talk to these HIV patients. We need not try and put our suggestions, but we need to listen to them. We need to have an empathic attitude towards them. We should not become judgmental. We should completely examine them from top to bottom. Especially, we need to see for gynecomastia, testicular atrophy, which may indicate hypogonadism. Check for gross loss of weight, muscle loss, fatigue, depression, mood, and anemia. Detailed sexual history, which includes his peers, masturbation history, history of his orientations, his acceptance by his peers and his family about his altered identity should be asked for. Addictions should be asked for. Routine blood works, HIV panel, hormonal assay, penile Doppler studies, and nerve conduction studies need to be. You need to distinguish between organic and psychogenic erectile dysfunction. If he's a younger boy and if he's getting morning erections, if you ask him, he does not have organic erectile dysfunction. He's got a psychogenic erectile dysfunction. Now the third reason is pharmacotherapy. All antiretroviral drugs are associated with different degrees of sexual dysfunctions. The highest rate of dysfunctions are associated with a drug called indinavir, and the lowest is with nevirapine. Drug interactions are very, very common because of these drugs are metabolized by the cytochrome P450 system. And when we give PDE5 inhibitors, we need to be very cautious. We need to reduce the dose to 1/4. Sildenafil should not be given more than 25 milligram and not every day, but every 48 hours. tadalafil 10 milligram needs to be given 72 hours, every 72 hours. And vardenafil, which is very potent, should be given in a very slow dose. Testosterone replacement is of great benefit in patients who have got hypogonadism. The use of topical testosterone gel was shown to be having the best result, and it also improved erythropoiesis, weight gain. It prevented the bone loss, which is associated with hypogonadism. It increased energy and it improved the mood also. Improvement in sexual desire was also seen with letrozole, which is nothing but an aromatase inhibitor that inhibits the conversion of testosterone into estradiol. What is the other therapy? Psychotherapy, there has to be supportive and psychological therapy we need to give. In supportive therapy, we should counsel them and demystify the myth which they are carrying that it's a lethal disease. And it is, we need to encourage them, remove their guilt, fear, and help them not to get discriminated by the society. Psychosexual therapy includes sensate focus, masturbation training, and the individual, if he is positive, we need to make him accept psychologically, but still the dysfunction remain in them. We need to motivate them for non-coital gratification, which includes use of toys, dildos, also include hugging, kissing, and spending time together. Take up some good hobbies, etc. We need to educate them psychologically for safer sex, because we need to explain the risks of contact with different strains of HIV, which favors the development of resistance to antiretrovirals. If we do not advise them, the antiretrovirals will not work on them. We should also advise them on lifestyle modification, which includes safer sex, exercise, modification of heart cardiovascular risk factors, education about the use of effects of recreational drugs, which were very. These are two beautiful studies which I've seen in the United States. They studied about 2,275 men having sex with men, and they found that sex toy use was very common among this population. And this gives us a room for discussion of sex toys as a tools to enhance pleasure and reduce the HIV sexually transmitted infection or transmission. And this is really undebatable. So use of sex toys have been recommended and have been studied extensively. In patients who are having sex with men, there's a beautiful study done in Boston, Massachusetts. 189, they were all using 100% of them condom use and sex toys. This helped them reduce the risk of acquiring or transmitting HIV infections. Another study done in United States for gay and bisexual men. This study was done with 25,300 around patients. The data suggested that sex toy use is common among gay and bisexual men during both solo and partnered sexual activities, and considered by these men as enhancing the quality of their sexual experiences. With the availability of the heart and alternate ways of gratification like sex toys, etc. Now, when a patient of HIV receives the full medical care, counseling on his sexual difficulties, they feel valued, and they'll be more open to engage in adherence to both medications and safer sex strategies, which we all aim for. Learn practices to minimize the risk of acquiring other sexually transmitted infection and transmitting HIV to others. This is the education which we need to give them. There is high prevalence of erectile dysfunction in younger age. Now, what we see in our practice, mainly patients who do not have HIV, elderly patients get erectile dysfunction who are above 40, 50, 60 and all that. But here, what we see, ED is more common as men get older. This is a general prevalence. But here, younger HIV infected men in this study was proven that there was a unique association between ED and HIV, and making this condition a peculiar clinical hallmark of HIV infection in younger generation. So erectile dysfunction is seen at much, much younger age in patients who have got HIV positive. What HIV facts, why HIV is not going? It is a 3-decade-old. There is so much of research done, but why still it's not going? Because it's at early age. Little lifestyle skills and sex education were available. condom use was considered as something which is not ideal or not comfortable. They had multiple partners. Stigma and discrimination was too bad. They used sex for money and sex for so many other things. The patients used a lot of substance abuse, which worsened the whole thing. Men having sex with men had also homophobia. There was gender inequality, and gender roles were not taken care of considerations. There is definitely
Hello?
between sexually transmitted infection and HIV. Persons with sexually transmitted infections are more likely to have sores, cuts, and these small breaks in the skin and lining of their genitalia are responsible for the spread of the infection. HIV can more easily enter the body through these breaks. Talk to your partner about HIV, use of condom on regular basis, reduce the number of male partners, get tested, know your status. You cannot get HIV by hugging, touching, living with or caring for someone with HIV, shaking hands, kissing. You cannot get HIV for eating out on the same plate or cup or utensils that an HIV person uses. You cannot tell anybody by looking at that this someone has HIV. An individual can look and feel very well for many years and still be HIV positive. The HIV positive person can pass the virus to someone else. That is the risk we have. And what we see today is in women, it is very common because the gender inequality is a big issue. Women, particularly in the rural areas, have little control over important aspects of their lives. Intimate partner violence, including sexual violence, is relatively widespread in the rural as well as urban. The power imbalance between men and women means women are often unable to negotiate, maybe it's condom use or to protect themselves or from risk of HIV or even having sex. Women living with HIV are reluctant to access the healthcare because of the fear of getting discriminated and marginalized, and leading to death rate in HIV young women at a large. This is a first human who was cured with HIV.
Giving hope to HIV positive people.
He also had cancer. He was given bone marrow transplant, stem cell transplant.
Yes, I would like to meet the London patient very much.
There's a second patient in London who's also getting cured with HIV.
If you want to become public, do it. It's not really a burden that I'm going through with media and stuff like that. It's actually fun. So you could share in the fun. It's been very useful.
What Sri Ravi Shankar ji has to say.
So faith community can take this oath and promise from people to shun discrimination against people with HIV, to look at them with compassion, and to make people aware, youngsters aware, boys and girls aware, the dangers of HIV and how they should avoid it, prevent it.
So education is the key, awareness is the key, counseling is the key to these patients. It is not a lethal disease, it is not a death sentence.
So faith.
This is my book, Sex Has No Expiry Date. Friends, my last slide. HIV/AIDS is not a death sentence, it is preventable. Sexual dysfunction with HIV/AIDS can be managed. Use of sex toys has highest level of gratification and are safe. Empathy, compassion, indiscrimination, and love can make a life of an HIV individual more meaningful. Thank you all for your love.